Alright, ladies and gentlemen, and welcome to this episode of Fika's Morning Brew. Today, we're going to be discussing high-deductible Medicare Supplement Plans. Now, these are great options to fill in the gaps left behind by original Medicare while offering you, the beneficiary, an opportunity to save a little money on your monthly premiums. Now, in this video, you're going to learn the basics of Medicare Supplement Plans, also known as Medigap Plans, and how their high-deductible option works. So sit back, enjoy, and I'll see you right after the intro. Hello again and welcome back, ladies and gentlemen. I'm Chris Johnson and I'm the founder and president of the Fika Insurance Group. Now, for those of you that don't know me, I'm a licensed professional in the insurance industry and have been helping people just like you for over 10 years. Now, we created the Fika Morning Brew series to help consumers like yourself better understand and navigate the complicated world of insurance. So if you haven't subscribed yet, please do so in order to help support and grow our channel. You can also feel free to click the like button if you find the content to be helpful. Additionally, here at Fika, we love to hear your thoughts, so be sure to send us your comments and leave any questions below. Alright, ladies and gentlemen, it's time to grab your cup of coffee and let's jump into today's topic. Now, the first thing I want to do is I want to cover a little Medigap 101. Now, did you know that Medicare Supplement Insurance, aka Medigap policies, have been around since 1967 and they're one of the more popular options to cover the gaps left behind by original Medicare Parts A and B. Now, they're sold by private insurance companies and cover benefits, well, that original Medicare doesn't offer. For example, emergency foreign travel. Now, another interesting fact about these plans is that they can be used at all providers and facilities that accept Medicare all across the country. Now, a Medigap policy pays second to Medicare. This means that all claims must first be filed with Medicare, who will calculate their approved amount and pay their portion. Then, that's where the Medigap policy will jump back in and pick up the remaining costs based on which plan you're enrolled in. Now, with that said, it's important to know that if Medicare doesn't approve of or pay for a particular service, then your Medigap policy will also not offer any coverage for that service, with one exception, and that is emergency foreign travel when it's applicable to your plan. Medigap, aka Medicare Supplement Plans, are all standardized except for the states of Massachusetts, Minnesota, and Wisconsin. Now, there are 10 options to choose from, all denoted by their very own plan letter. And it's A, B, C, D, F, G, K, L, M, and let's not forget about N. Now, each Medigap policy under the same plan letter must offer the same benefits regardless of which insurance carrier sold it. So that means that a Plan G with Company 1 is the same Plan G coverage you're going to have with Company 2, and the same thing applies to Plan N. So Plan N Company 1 is the same coverage you're going to have with Plan N Company 2, right? However, prices, well, they can vary widely for the same plan letter across multiple carriers who offer it. Okay, now that we've reviewed a little Medigap 101, let's dive in pretty deep to high-deductible Medigap plans. All right? Now, there are two high-deductible Medigap plans available, and that's Plan F and Plan G. Now, these programs offer the same benefits as their standardized plans of F and G, but they only pay benefits after you satisfy an annual policy deductible. Now, the deductible, well, it can change year to year. However, at the time of this video, the deductible for 2022 is $2,400. $490. Now, there can be some confusion around the deductible because, well, it's been known to lead beneficiaries like yourself to believe that you have to satisfy all of your healthcare costs until you reach that deductible and you have no coverage. However, this is not the case. Luckily, during the deductible phase, Medicare still pays the claims as they always have. Once Medicare processes and pays the claim, now anything left over in the form of deductibles, co-insurance, or co-payments through Original Medicare must be satisfied by you, the member, until you reach your annual deductible. Okay? So the point is that you're still going to have a little coverage even before you reach your plan's annual deductible, but just note that that coverage level is going to increase once you've satisfied that annual deductible. All right, ladies and gentlemen, at this point, I would like to make, a little bit more of a point about spending money during the deductible phase. And it's an important one because it's important to note that while a high deductible Plan G doesn't offer coverage for the Part B deductible, the amount that you, the beneficiary, pays towards the Part B deductible, well, guess what? It will count towards your annual deductible, okay? It's also important to note that the high deductible Plan F option, well, unfortunately, it's only available to individuals that qualified for Medicare prior to January 1st of 2020. All right, guys, let's move on and discuss the deductible and how it works with some real examples. So first, let's talk about an inpatient hospital stay. Let's say that our buddy Paul spends 3 days in the hospital as an inpatient. Then, well, he's transferred to the skilled nursing facility where he receives some rehabilitation care for, we'll call it 15 days. All right, and then he's discharged and heads home. So let's look at Paul's cost under Original Medicare, and they would include a hospital stay for 3 days. All right, so he's got to cover his Part A deductible, which at the time of this recording is $1,556. All right, it's going to fall under his skilled nursing stay. Remember, he had 15 days in a skilled nursing facility. Well, that's not going to cost him anything because Medicare covers days 1 through 20. So Paul's total out-of-pocket for the hospital stay and the skilled nursing stay would be $1,556 in 2022, which once he paid that, it's going to apply towards his plan's high deductible of $2,490, which means that he would still need to spend another $934 in deductibles, co-payments, or co-insurances to satisfy the plan's annual deductible so that his benefits would kick in. All right, so now let's look at a Part B type example. Let's say Miss Beth receives cataract surgery at the beginning of the year in an outpatient facility. Now, Medicare approved amounts for the surgery was $2,825. So best cost under Original Medicare would include the Part B deductible, which at the time of the recording is $233. She would also have to satisfy 20% of the remaining cost, which would be $524. So best total out-of-pocket for the outpatient procedure would come up to $757 in 2022, which would be applied towards her plan's deductible of $2,490. Therefore, she would need to spend another $1,733 in either deductibles, co-insurances, or co-payments to satisfy the plan's annual deductible so that her benefits would kick in. So at this point, you're probably asking yourself, Chris, why do I want to choose a high deductible plan? Well, consider this. Medigap plans F and G, well, they generally have the highest premiums among all options A through N. But by purchasing a high deductible plan, you can reduce your monthly plan premiums by up to 73%. Also, as I mentioned before, you would have no restrictions on Medicare providers or facilities, so basically that means no PPO or HMO style networks. And again, the best part is you're saving money with lower premiums, but you're still offering yourself financial safety net on those future medical expenses. Well, everyone, that about does it for this episode. But before we go, I would like to leave you, with a few final thoughts. Now, there are a lot of don'ts, do's, and tricks to Medicare coverage. And yes, it can be, overwhelming. However, rest assured that my team and I here at the Fika Insurance Group, we're happy to help simplify the entire process for you. As an independent insurance agency, we're licensed and appointed with all the top insurance carriers throughout the country. And the best part about the services that we offer to you, there are no costs to you. So please don't hesitate to reach out with your questions or comments at 864-397-8866 or drop us an email at info@fikainsurance.com. And again, you can always leave your questions below and we'll be happy to respond. Thanks again for watching, and I hope you learned a little bit more about Medicare Supplement high-deductible plans. Until next time, guys, grab that cup of coffee, sit back and relax with your friends and family, knowing that Fika Insurance has you covered.